I've never been happy with my nose, but I've never felt like I could go through with surgery. But you know, it is if I could change anything on my face, it would be my nose. So when I read up about this, I was thinking this could be perfect, because I want subtle sort of changes, but I don't want to have to go through the savagery of surgery. And also my sister's had some problems with hers, so that's really sort of put me off. I feel like my profile in particular, I hate there's certain angles that when I have photos taken, I always want to be in a certain position. So I just feel like with a small bit of help, I could look a lot better.
Yeah.
Hence where you come in. So I'm hoping that you will be able to make me look better. Especially as an actor, that quite often in castings I have to stand in front of the camera and then you do your profile, and then my heart always sinks when I have to do that, because I do feel it has stopped me from getting roles before in the past, especially for commercial, where it's, you know, like a fleeting second of you, you know, looking at your phone or something like that, and it's all in the angles. So if you can make yourself look better in any way, then I'm all for small improvements. Well, as you can see, I've got a bit of a bump, and I just can't stand it, to be honest. I'm almost wanting you to tell me rather than where I don't like. It's a bit wonky, I think, and I'm not really sure what you're going to do to sort it out. I basically want it to look smaller.
Okay.
If that's possible. I don't want it to look like the nose starts from there, you know?
Yes.
So I just want it to look a little bit more streamlined. Like, I'm looking at your nose thinking, what a lovely little nose. But it's hard to know without a professional opinion of what you can do to it to make it look better.
Okay.
But apart from the obvious, you know, I think it's a bit beaky, it's a bit sharp, I feel like it's wonky. I don't mind head on so much. It is mainly the profile.
That's not as complicated as it may sound, because, you know, once you sort of correct the shape, actually the overall effect will be that it will appear smaller, even though it's not smaller, and you've added to it clearly.
Yeah.
So it's actually bigger, but it won't look like it, because it's very strategic placement of the filler, just to correct shape. So the light hits it very nicely, so you get the angles, nice clean angles that you want from all different angles of your face, and also so that, you know, so you're more photogenic. And it's more, you know, much more aesthetically pleasing, and therefore better for your career.
Yeah, exactly.
So you will be better on camera.
Perfect.
I think you have a great nose. It's really just little key areas that are sort of interrupting the overall effect.
I think since applying, you know, to have this done, I've actually become more critical of it. You know, before I just didn't like my profile, but now I'm looking at it from different angles. From the front, I'm like, it's a bit wonky, and I'm sort of looking at it in much more detail before, because I know that there are things that I can change about it.
Yes.
So then before, whereas you think, oh, I'm just going to just deal with it.
Yes.
I try not to fixate on it too much. But since booking this, I've been thinking, oh, I could do that, I could do this. But I'm glad that you can see that there are changes to be made. And I'm not just picking holes in myself for no reason.
No.
But there are things that can be made better. So.
Indeed, yeah, there are some things. Just a few key places. So if I look at you straight on, I can see there is a curvature in your bridge on your right. Okay, the left side is pretty straight. The only place it breaks is just where you're a touch deep at the top, which gives you that effect of having a bump, and also below where you have this deeper area on the side. Your tip is just slightly off to your right. It's quite subtle, actually. So your tip bones are just doing slightly different things, but actually that can be improved. I mean, obviously I can't really change what your tip bones are actually doing, but I can work over it so that it appears as though they are straighter and sort of both, you know, pointing together in a nice straight direction.
Symmetry. I know actually if your face was exactly symmetrical it'd look a bit strange, but I know there is a definite curve I didn't even know about really until the last couple of weeks.
And it's quite subtle, actually, the curve. It's not extreme dramatic, but actually subtle things do make a difference.
Exactly. I would like people to just say, oh, you look really well, rather than thinking, you've had something done. because it is going to be so subtle that
Yes.
unless someone like my husband, who knows my face, you know, better than what I know my own face,
Yes.
I think people probably wouldn't notice, would they? They just think you look well.
No, I mean, generally speaking, nearly always people say that nobody noticed, or that they were really shocked if they shared it with them. You know, and I've had people say that their parents were really shocked, and, you know, brothers and sisters, and they're just always amazed that people didn't know. The nice thing is when you've had injections, unlike a surgery, you don't look as though you've had something done. Yes, the nose is a bit puffy. Yes, it's a bit red, but you look more as though you're suffering from the flu very badly and you've blown your nose a bit too much, because no one actually knows what it looks like to have filler put in, and also it's different for everyone. So what does that even look like anyway?
So will it, with the whole nose, be quite red?
You probably will. In the areas where I've injected you, it will look a bit red, a bit glowy, shall we say.
Got my cream, my arnica cream. Hopefully that will help.
Excellent. Yeah, it's really good arnica cream. It's very soothing. It helps bring down swelling. Also, if you have any bruising at all as well, it's going to help that to go a lot faster than if you needed to its own devices. You won't be hugely swollen today. You'll just have a little bit of prominency, so it'll look a little bit higher, maybe a bit sharper, slightly fuller than it actually will be. It's tomorrow morning. That's when true swelling really sort of kicks in, and you will notice it, and you will just look as though maybe, you know, you've got hay fever or flu, something like that. There are no real giveaway signs that you've actually had some cosmetic treatment. So it's not a hindrance in that sort of way. It's just you won't be looking picture ready, or, you know, as lovely as you will do when it's fully settled in here.
How long do you think that would be?
In total, 100% 2 weeks. Yeah, because a lot of things happen in that time. Actually, most of that swelling will actually go very early on. So I would say probably in the first 3 to 4 days, most of that will go. And you have that you refer to as sort of residual swelling. It's there, but it's subtle, but it's not a truly nice refined result. You only really realise that it was still swollen when you see that actually, yes, it's come down a bit more.
Yeah.
Yes, it's looking a bit finer, a bit nicer, and so you just see this nice improvement as you go along. But also as well, the filler will sort of move a bit deeper into the tissues, and this is what I refer to when I say it's settling in, so sort of moving more into the tissues around it, and so it doesn't look quite so sharp. You get a much softer look.
Right. And the filler sort of works with your body, unlike some sort of things you can put into yourself. It's I wouldn't say natural, but the body likes it?
It is a natural substance actually. It's the one that I'm working with, because there's lots of different types of fillers out there, and some are natural substances, some are synthetic, some are dissolvable, some are not. This is dissolvable, okay, which is really important for health reasons, for, you know, should you have an emergency situation where actually we need to remove filler, then this is essential to, you know, sort of making you well and keeping you safe. It's natural in that it comes from a type of grass. It doesn't come from a human being, but we do have the exact same substance actually in our body that is native to us, because we make hyaluronic acid. It helps our body to hold water. It's all around and in between our tissue matrix and our connective tissue and in our skin. And helps us hold all the moisture that we need in the body. So it's a very important substance, and that's probably why it actually responds so well to hyaluronic acid filler. Actually, out of all the dermal fillers, it seems to be the most well accepted into the human body. You can have allergic responses. It is possible, as you can with absolutely anything, but not everyone does. It's quite uncommon. But once in a while, yes, we do see reactions that we would refer to as inflammatory responses. So
right.
It is just randomised inflammation that comes out of nowhere.
Does it just generally go down, or
no? It's something that must be treated with steroids to get that inflammation under control. And actually, the sooner that's done, the better, so that we can put that to bed for good, basically. True allergic reaction, is what we call anaphylaxis. It's like a life-threatening condition. Is very rare. That's like 1 in 50,000 people will have that. But this type of inflammation that I've just described is the type of thing that we would see more commonly than anaphylaxis. So if you see anything actually that's concerning at all, it's always best to check in with me. Never assume that it might be okay, it will go away, because the sooner we treat any type of complication, really, the better it is for your recovery.
So how rare is that? People have a reaction?
Very rare. I mean, I've been doing this for a long time, and numbers that I see are very, very, very low. So if I had to give a percentage, I wouldn't actually know what it was, but it would be really tiny.
So it's something you have to explain to everyone, but it's not something for me to worry about.
Yeah, indeed.
Okay, indeed. Yeah. Once I've had this done, can I put the cream on straight away? Or best to not touch it for a little while?
I would give it probably about an hour, just for the little holes to kind of dry up a little bit, and then you can put it on. And then keep topping it up every hour, because you'll find that it will dry out. You'll need to wipe it away and then refresh it. So just keep doing that as much as you can over the next few days, and
So when I've looked at people's before and after pictures, it varies how much you're actually using on each person. So can you not tell me that until you actually start doing it and see where you're going to go?
For most people, it tends to be 1 ml. For most. And then now and again I'll get somebody who might need a second mil, but it's not always obvious that they need a second mil until you allow for that movement of the filler into the tissues.
Hence the when you come back in a couple of weeks. Can be.
Or maybe even after a few months actually, you might find that actually yes, more is needed. But for most people it tends to be 1 mil. I think for you, I think 1 mil should be good. You'll probably need to do some maintenance maybe about 6 months or so. It may last longer actually. It can be anything from 6 to 12 months, and occasionally I do see people who it lasts even beyond a year.
I do a lot of exercise, so I've read that if you do cardio and stuff, it's likely to come out of your system a little bit quicker.
It can do, and there are so many different theories about what makes it last longer, and it is different for everyone, because sometimes I get people in who I think, okay, this is not going to last very long for you, and they are those people who are super active, lots of muscle mass, who have this this wonderful efficient metabolism, so they should be coming a lot soon, and actually they can be the opposite too. So we do see all sorts. So it's a very individual thing.
Yeah.
What I can say to you is however it lasts the first time round, every time that you do your maintenance, it will last longer than previously, until you're really hardly doing it ever at all.
Okay.
So you always get more longevity with each treatment.
Right. Great.
I do the whole face,
right.
And I work with anything that you can do with fillers. I do it basically. So 2 troughs, cheeks, noses, chins, lips.
Can you look at my face? What else
everything.
Can I have done? Right, tell me what else I can have done while I'm here. So I have had some Botox done in the past, but literally because I'm an actor, I need to be able to have full movement of my face, and I don't mind some lines, but I just had a little bit around my eyes.
Yes.
And just because they're a little bit crinkly now.
Okay.
But
so just to sort of soften the eye a little bit more.
Yeah, sure. But I wouldn't say no to more work in the future, just because you've got, you just want to look good for your age, don't you?
Yeah, absolutely. Just maintaining and just looking your best is usually the goal for most people that I see anyway.
But I didn't realise quite how wonky it was until now I can see it straight.
In comparing it.
I'm really happy with it.
Oh.
Yeah.
Well, you'll love it.
I was scared, thinking that it was going to be so different that people would be like, but it's not. You just look, because it's still me. Like my sister-in-law said to me, "But I love your nose. That's just you." Like, but I was going, it's not making me look that different, and it's exactly what I wanted.
Yeah, just to look like you know.
Yeah, because I don't hate my nose in that you know, it's my character and all that. You know, I'm not going to have a little button nose, but
Yeah.
it's making the nose that you've got the best that it can be, basically. And it just looks really straight and nice.
So Kate, it's been 2 weeks since we did your treatment. Just tell me a little bit about how it's been for you since you had your treatment, and you know, what that experience was like while you were healing afterwards.
Yeah, well, I've been pleasantly surprised that I haven't had any bruising, for one. I think I was expecting to be a little bit more sore than what I was. I had a bit of tenderness here and in the tip. If you caught your nose on the edge of the jumper, you knew all about it for a couple of days, but that literally lasted 4 days maximum. Didn't have any bruising or any redness. It just felt, as I woke up in the morning, I thought, oh yeah, it does feel a little bit tender, just where you know, the main areas where you injected.
Yes.
But I used the arnica cream for a couple of days, but I don't even think that was necessary really, just done that as a precaution. And yeah, a couple of days in I completely forgot that I'd even had it done. And 2 weeks in, it just feels exactly the way it did before, to be honest. And it's amazing how quickly you get used to it. And it's such a subtle change that, you know, you don't look in the mirror and think, oh, I look so dramatically different. But I just feel more confident in my profile, definitely. And I had an audition last week, and when I did my profiles, I felt like, oh, it's okay, rather than, oh no, there used to be a bit of a feeling of dread. But I feel like what you've done is just really streamlined it, and in the areas where I had a little issue with, that's gone. So
work-wise, it's been quite empowering.
It has. It definitely has. In that, if you've had an insecurity your whole life, and then it's made dramatically different, and you don't feel quite as conscious, I guess.
Sure.
So, you know, I know it's far from perfect without having surgery, but the improvements that you've made to it, and what I was amazed by was that you saw things in it that I hadn't even really noticed, like actually how wonky it was, and the difference of, you know, rebuilding one side of it to make it straighter. I really think has made quite a lot of difference from the front, because I was thinking that probably you'd only be able to notice from the profile, but actually now when I look at photos I really notice how wonky it was. So I think your experience and expertise has really changed it for the better.
Oh, that's wonderful.
And I think I should definitely be having it done every year. I'm hoping that I'll be one of the people that lasts a little bit longer than 6 months, but because I obviously do quite a lot of exercise, yes. I think that might affect it.
A little bit. It can be one of the contributors to how long it lasts for. But the first time that you do a maintenance treatment will always be the soonest one that you do anyway. After that, actually, they last dramatically longer. So whatever you get, whether it's 6 months or, you know, anything up to 12 months, actually you will get more than that on the second time around, and then more than that the third time around. So your maintenance becomes quite few and far between after a few of them. Yeah,
definitely. I think I have to work that into my beauty regime every year, because actually it's probably going to be the most important thing.
And actually, I have to say, you even get more back from the treatment as well with future treatments, because with your next one, what you'll get really is the next level. So you'll get more refinement, it will be straighter, a bit more perfected. You know, because right now what we've done really is just sort of lay the foundations. And yes, it's given you some lovely changes and things, but actually you will get the next level on your future treatment.
Yeah, which is definitely where I'd want to go. So there's only so much you can do with Restylane, but I've been really impressed with the product as well. I've not felt any, I don't know, I always worry about this sort of thing, you're going to feel like, oh, it's going to feel lumpy or anything like that. Everything just feels very sleek.
And did anyone notice? Has anyone commented?
Well, a few of my friends I told about having it done, so they were on the lookout for it. But my best friend, who I've known since I was 4, said I wouldn't have known had you not told me.
Sure.
And it's only when you do the before and afters that you see there is quite a significant change. But no one studies your face the way that you do yourself.
Yes.
So, I can really notice, and my husband can really notice.
Yes.
But to friends, I'm looking at your face, it's your own issue. I think other people just see your whole face as one.
Absolutely.
They don't sort of zone in on a certain part. I can't believe that it's been 2 weeks already. It's gone so quick, and I've just completely forgotten about it, to be honest. There's not been, I think, where I've had no complications whatsoever, apart from a little bit of tenderness for a couple of days.
Yes.
And even then, I was still able to go to my yoga class the next day.
Yes.
And I was able to leave here. I probably could have gone shopping and that, and no one would have even batted an eyelid.
Wonderful.
It's a little bit pink. That was it.
Yeah. That's great. That's really wonderful news.
I'm looking forward to seeing my before and after pictures of side by side to see quite how different it was.
Indeed.